in-office tooth whitening treatment. To get started, your dental professional will determine the shade of your teeth with a shade guide. As a precaution, you'll wear protective eyewear during the procedure. A lip and cheek retractor will be placed in your mouth, followed by a bite block to keep your tongue and lips clear of the whitening gel. A barrier will then be placed around your gum line. This will help ensure that once placed, the whitening gel will only come in contact with your teeth and not your gums. With the barrier in place, your dental professional will now apply the first application of Opalescence Boost to your teeth. The gel will remain on your teeth for about 20 minutes. After the 20-minute whitening period, the Opalescence Boost whitening gel will be suctioned off your teeth. Your dental professional will then evaluate the shade change of your teeth. If you need additional treatments to achieve your desired results, your dental professional will apply a second application of Opalescence Boost. Up to 3 applications may be applied in a single treatment. Following the final application, the barrier is easily removed. Because Opalescence Boost begins to work immediately after it's placed on the teeth, the total whitening procedure is fast, typically lasting about an hour. This includes 2 to 3 20-minute applications of Opalescence Boost for a total of 40 to 60 minutes of whitening time.